As coronavirus COVID-19 continues to destabilize different economies and affecting various facets of life across the globe, Kenya now seems to be facing even greater challenges in the wake of the pandemic, with the government saying it now poses a threat to gains made in immunization and the country's maternal health. Confirming this, Isiolo Governor Mohamed Kuti says Kenyans are now shying away from seeking services in health facilities due to fear of coming into contact with infected persons.
Because of stigma of health facilities, pregnant mothers are fearing to go to health facilities. Immunization has now gone down, and today in our National Emergency Response Committee, efforts are being discussed, and there is going to be discussion between Council of Governors and Ministry of Health in order that we identify COVID health facilities away from normal health facilities.
Governor Kuti adding that the move will ensure that the country does not renegade on the achievements made to ensure that every child receives vital vaccines and curb maternal mortality rate in the country.
The malnutrition that we have countered because of regular weighing and other activities like HIV and TB should not be lost because of mixing COVID patients and other normal patients.
This even as the government confirmed more positive cases of coronavirus COVID-19 in the country.
In the last 24 hours, we have confirmed 12 new cases of coronavirus in the country, bringing the total number of confirmed to 355. 8 of these are from Nairobi and 4 from Mombasa.
Meanwhile, on its deliberations today, the National Emergency Response Committee on Coronavirus is said to have addressed the issue of forced quarantining of those arrested for breaking the dusk to dawn curfew, terming it a serious issue that needs to be dealt with.
It is going to be dealt with very, very soon, such that a quarantine is if you are in contact with a positive case, then you are quarantined for that reason. You are not a law breaker. You are not in any way broken any law. And there is nothing stigmatized or there's nothing negative about it. It's a public health strategy. But if you are walking at night, you are a law breaker and you should be dealt with. Maybe the place to go is the quarantine within prisons.
Kuti adding that expanding the country's testing capacity will go a long way in determining the extent of the disease in the country. Gloria Milimo, K24, Punchline.